The thing about talking to doctors is that it usually leaves me wanting to impale them or myself on a metal fence. So this brilliant chat I had with a retired doctor made a nice change. You can tell he doesn't think that the drug that ruined my health is as dangerous as I do, a drug he'll have prescribed for decades. Unfortunately, it's one of the most popular drugs in the world. 10 people on it, and it destroys the stomach's ability to function properly if you take it for longer than 2 months, according to the FDA. Now, they're no angels, so if even they say it's catastrophic, then you know that it must be. I was put on it every day for 4 years, and you'll hear what it did to me in a minute. I've had to silence the name out, but if you download the first chapter of my health guide below, which has got loads of immune system boosting tips in it, you can read about it in the introduction. Dr. Allen really knows his stuff, and when a second doctor joins us, you can see he's not alone in condemning the practices of the NHS over the last 2 years. Are you alright?
How you doing?
Can I have a chat with you by any chance?
Yeah, go on, please do.
Yes, so what do you think the gravest issues are for people to listen to an NHS doctor like you discuss about what's going on right now?
At the moment, the gravest issues are towards young people who have been injected with an agent. It's not really, it's a disease-modifying injection. They've been injected with, there's no long-term safety data on it at all. It's novel gene therapy, and these kids being injected, infinitesimally small risk of dying. It's a big study from UCL in July, a huge study, showed that for a healthy youngster under 18 or younger, their chances of dying from COVID are 1 in 2 million. Now in the UK, to put that in perspective, the pregnancy-related death rate is 1 in 4,000. That means death in pregnancy or in the 12 months following. That's 1 in 4,000, 500 times as great as a youngster's chance of dying of COVID. Right. Incredible. And they're injecting these kids. The JCVI didn't want it to go ahead, did they? No. And Whitty overturned it on the basis of educational needs. What nonsense. So that's my biggest concern.
Yeah, I've heard some people saying the JCVI changed their own minds, but...
Oh yeah, I'm sure they did, yeah. It's a panel of 12 experts and 1 lay person, and they deliberated over their decision about 2 months ago. I think they decided it was a no-no. They long and hard, looking at all the data, they said no. The risks, the benefits do not outweigh the risks. You shouldn't do this. And Jace, over the course of they deliberated for months. Over 1 weekend, they said that on the Friday, I believe, and on the Monday, Whitty gave it some thought and overturned it. Absolutely incredible. Where are we going with this?
Yeah, it was Whitty, for sure.
Absolute nonsense. So that's my biggest concern, young kids. The average age of people dying from last year in the pandemic, these are ONS stats, 80 years and 5 months. If you look at the average age of death for the 5 years preceding that, it's 81 years and 4 months. So they were 11 years younger last year. So we're injecting these kids with a vaccine we know doesn't stop them spreading it, doesn't stop them catching it, essentially a cold, to protect 80-year-olds so they can live an extra 11 months. Give me a break.
Yeah.
Something's gone badly wrong here.
Yeah, and what do you think about doctors recommending the people when they don't know what the ingredients are?
I find lots of doctors, I've been struck by my colleagues, I retired last year, ex-colleagues, their level of ignorance, what's in it, how it works. I think they've wised up in recent months because it's become so topical. But I think a few months ago, lay people that had researched this knew more than their GPs.
Yeah.
The GPs have been embarrassed now and they've caught up with them, but not impressed with the level of knowledge.
Yeah, I mean, there's informed consent can't be given by someone who wasn't informed themselves.
Oh, that's the other thing. The GMC have got strict parameters for informed consent, and they are the nature of the treatment, the benefits of the treatment, the side effects of the treatment, either known or possible, not unlikely, alternative treatments, and time must be given for discussion. The patient must be made aware that they're a subject in a trial. None of that's happened. Those are GMC core guidelines that have existed for the last 20 years. They've ignored them. Now the crucial thing is, if someone does not get true informed consent, acquire true informed consent and gives a treatment to somebody and it has an adverse outcome, the giver is criminally liable. Not their employer or the person who told them to do it, the person who did it. So lots of these people that are doing drive-through jab centres, wind your window down and I'll jab you, it's not informed consent. They could find themselves in hot water unless they change the law.
I was put on a drug called that every day for 4 years.
Yeah.
When I was 26.
Yeah.
And I had an H. pylori infection. So basically, it's a first-line treatment. I should have been put on it for a week.
Yeah.
With a couple of antibiotics.
Well, you've forgotten about.
No, I was pretty persistent in talking to doctors, gastroenterologists, and GPs. And no informed consent was given to me. I was basically led to believe, with a bunch of doctor garble, proton pump inhibitor. I mean, you think, what's that Star Trek stuff? You know, I didn't know what they were talking about. We believe that we've been given a pharmaceutical grade Tums, basically, that deals with acid once it's in the gut. Yeah. She blocks acid from entering the gut.
Proton pump inhibitor.
Yeah.
It's
So,
not made.
what do you think about that drug being overprescribed to people?
It's almost become a lifestyle drug in the UK. For people, they're stressed, they're smoking, they're drinking, or they just get indigestion. And the proton pump inhibitors, that class of drug, the drug companies have made a lot of money out of it because we're treating what is essentially, for many people, a lifestyle issue. They just need to change their lives, get some more sleep, be less stressed. But
Change their diet.
Change their diet. But it takes time to tell people that, doesn't it? To talk to somebody. Here's a pill. Off you go.
Yeah, I mean, I've got small intestinal bacterial overgrowth, Lyme's disease, neutropenia, suspected colitis, fibromyalgia, all as a result of irreversibly destroying my precious cells and proton pump's ability to function. And I'm pretty angry about it. There was no informed consent whatsoever, so it's what's been going on for a long time.
If you feel that you've been given a medication without informed consent, I would encourage people to pursue a case.
Yeah, well, you can't sue if it's 3 or 4 years, 3 years after you've been given it.
I don't know exactly what the rules are, but I do know.
And you do have to prove that a doctor has behaved erroneously from all other doctors, and they're all overprescribed.
Yes, I think this is about to blow over.
What does that say at the top there? Get off of your knees and make them pay.
Do you want to see the other side?
Oh, I've got it already.
You got that?
Yeah.
All right.
Yeah.
Hello.
I just wanted to introduce myself. I'm a fellow doctor as well.
Hello, nice to meet you. Ricky Allen. Hi.
But yeah, I'm a junior doctor. I'm doing my F2 at the
Good for you.
moment.
How's it going? Where are you doing it?
So I'm doing it down in Ramsgate.
Oh, right. Well, I've come up from Canterbury.
Have you?
Yeah, I live down there.
Okay,
So,
yeah, I live in Ramsgate.
so what practice you at?
So I'm at the community run.
Okay.
Yeah.
I worked in Ramsgate for a year or two. I worked at QEQM for my last 2 years. I retired last year in the A&D.
That's what I'm doing, well, in April.
Are you in A&E at QE?
In April, I'm QE.
At QE at Margate?
Yeah.
That'll be fun. Say you met Ricky Allen.
I will, and that's my brother in the green coat. He's a GP.
Oh, where's he a GP?
He's a GP in North London.
Oh, right.
Yeah.
He's a happy GP? What does he think about all this business?
I mean, yeah.
It's bonkers, isn't it? The world has gone mad. It's as if everybody has abandoned rational thought or critical thinking. And it's got nothing to do with intelligence.
Yeah.
Some of the sort of cleverest minds in medicine that I know have just... It's cognitive dissonance.
Yeah, no, exactly.
Much better, much easier for most people to swallow a lie than accept an unpalatable truth.
Whereabouts are you working at Canterbury now?
No, I retired last year, that's why I can say. Without, whereas you've got to keep your hood pulled up, because they'll get you.
Yeah. But, well, we'll see what happens in April.
No, you'll be
anyway.
fine.
Can I tell you guys a little story about a doctor I met the other day in the pub? He said that he was Boris Johnson's doctor when he had COVID, and I had a bit of an argument with him in the bar. He basically said that we should all be locked up because we're going to fill up his ICUs, and I tried to explain to him that if 99% of the wealth wasn't funneled out of the economy every year, he would have enough ICUs to deal with whoever, and that he shouldn't be demonising the most vulnerable, sick people in society who can't get it. When he's a doctor and he's supposed to be looking after sick people. What do you think about that? What do you think about what he said?
Well, I would say he's talking out of his backside, because if he feels like ICUs are going to be overwhelmed, why did they build the White Elephant, Nightingale ventilation hospitals this time last year. They've since shut them down because there wasn't the demand. So,
Yeah.
so I find that doesn't stack up against what he's saying, unless he's living in a parallel universe. But that's what happened here. They
Yeah.
shut, though. Hundreds of millions was given to contractors to build these hospitals. To rent, they were all unused. God knows where the money went. It will trickle back into this place opposite, though, in the years to come. They were shut down because no one. So I don't. Your A&E man. I don't know where it's coming from.
Yeah, he said he was a surgeon and that he ran the pandemic. He said, I ran the pandemic, and I was like, okay. And then he basically said that I didn't know anything because I just read stuff off the internet, and then I lectured him about bacterial infections, and he was like, he was very rude and raised his voice to a young lady as well.
Doctors can be quite rude.
Straight away. Yeah, he's very arrogant, and he didn't make sense when he spoke, unfortunately. They work. He said it 3 times, and I explained, well, if
What
they
do they
work
work at doing?
and I said, if they work, why do they have to have boosters every 6 months? That's planned obsolescence built into which is typical big pharma behaviour to maximise profit.
Yeah.
The profit motive trumping the health
If you have to
motive.
have a booster every 6 months, it's not, is it?
No, it doesn't work. It doesn't stop transmission.
Hiya, please like, share and subscribe and keep your eyes peeled for my upcoming channel, The Director's Gut. Lyme's disease and SIBO are threatening my speech, so I'm writing an evolving health guide and asking for donations in order to fund treatment. The links are below. Cheers!